What if I told you there's one exercise, and I mean one where you don't even move, that beats cardio in 270 different studies involving almost 16,000 people? All you need for this exercise is a wall, the one right behind you, wherever you're sitting. I'm Daniel Harris, and today I'm going to show you the single most effective exercise for lowering your systolic blood pressure, more effective than cardio, more effective than HIIT, more effective than resistance training. By the end of this video, you'll know exactly what it is, why almost nobody is talking about it, how it actually works inside your body, and the exact way to do it correctly. Let's get into it. The silent killer here's a fact that should stop you in your tracks. Over 50% of adults in the United States have high blood pressure, and a huge portion of them have no idea. That's why it's called the silent killer. There's no obvious symptom, no warning light. You feel completely normal, go about your day, go to work, go to the gym even, and meanwhile, your arteries are under constant invisible strain. Often the first sign people get is a heart attack, a stroke, or a diagnosis at a routine checkup they weren't expecting. This is exactly why finding an exercise that specifically targets blood pressure, not just general fitness, matters so much. And that's where things get interesting, because the answer isn't what most people expect. The exercise I'm about to show you belongs to a category called isometric exercise, meaning you contract your muscles hard without any actual joint movement. No reps, no running, no weights moving up and down, just a sustained, controlled contraction. And for decades, this entire category of training has flown almost completely under the radar of mainstream medicine. Why doctors never recommended this so? Why has something this effective been ignored for so long? It comes down to some early research that got misinterpreted. Back when isometric exercise was first being studied, researchers noticed that blood pressure spiked while people were doing it. That finding got picked up by clinical guidelines, and the conclusion was simple. If something raises blood pressure during the activity, it must be bad for people who already have high blood pressure. So it got flagged as risky, and physicians were told not to recommend it to anyone with hypertension or heart issues. Here's the problem: that conclusion was based on a short-term snapshot, not long-term outcomes. A lot of exercise science historically leans on observational data, where researchers simply watch what happens and draw associations, rather than running controlled, long-term trials. Observational data is useful, but it's nowhere near as reliable as a randomized controlled trial followed over weeks or months. When researchers eventually did follow people over time, they discovered that spike in blood pressure during the exercise was temporary. It came right back down afterward. And with consistent practice, resting blood pressure actually dropped significantly below baseline. But by the time that research came out, the guidance had already been set. Cardio had become the default prescription, and it's stayed that way in most clinics ever since. The 2023 study that changed everything this is where things get really compelling. In 2023, the British Journal of Sports Medicine published a large-scale review that pulled together 270 randomized controlled trials covering close to 16,000 participants. That's an enormous sample size for exercise research, which makes the findings far more trustworthy than a single small study. Researchers compared how different types of exercise affected systolic blood pressure. That's the top number in your reading, the one that reflects pressure in your arteries when your heart beats. Here's what they found. Combination training, meaning a mix of cardio and resistance work, brought systolic pressure down by just over 6 points. Resistance training alone brought it down a little over 5 points. Aerobic exercise, your classic cardio, walking, jogging, cycling, brought it down by roughly 4.5 points as well. High-intensity interval training, HIIT, brought it down by about 4 points. And then there's isometric training. Specifically, the wall sit brought systolic blood pressure down by more than 8 points. Other isometric exercises, like isometric hand grip training, came in slightly behind the wall sit, but every single isometric variation still outperformed cardio, HIIT, and resistance training. Now, I do want to be fair here. If your issue is specifically diastolic blood pressure, That's the bottom number. Cardio actually performed the best for bringing that one down. So this isn't about throwing out cardio entirely. It's about recognizing that if your main problem is the systolic number, which is the case for most people with high blood pressure, isometric training, and specifically the wall sit, is the most powerful single tool in the toolbox. Why this number matters so much, you might be thinking, okay, 8 points, is that even meaningful? Let me show you why that number is a much bigger deal than it sounds. A massive meta-analysis published in The Lancet analyzed 123 studies covering more than 613,000 people. They looked at what happens across large populations when blood pressure drops by just 10 points. The results were staggering. Major cardiovascular events dropped by 20%. Coronary heart disease dropped by 17%. Stroke risk dropped by 27%. Heart failure dropped by 28%, and death from all causes dropped by 13%. That's from a 10-point reduction. The wall sit alone gets you an 8-point drop, remarkably close to that threshold, all from 24 minutes of exercise a week. Here's something else worth knowing. A lot of individual blood pressure medications, when studied on their own, show a reduction in the same range, right around 8 points. That means this simple bodyweight exercise is producing a drop comparable to what you'd get from a single prescription drug. That's not a small claim, and yet it's still nowhere near standard advice from most doctors. Medical guidelines tend to lag behind the actual research by somewhere around 10 to 15 years, and isometric training for blood pressure is a textbook example of that gap.
How standing still can actually lower blood pressure. Now let's get into the part that trips most people up. How does an exercise with zero movement lower your blood pressure? Especially when your blood pressure typically goes up during exercise, not down. Here's what's actually happening. When you're holding a wall sit, your thigh and glute muscles are locked in a sustained, forceful contraction. That contraction physically compresses the blood vessels running through those muscles, similar to putting a kink in a garden hose. Blood flow through that area gets restricted while you're holding the position. Then, when you stand up and release the contraction, all that blood comes rushing back through the vessels at once at a much higher velocity than normal. That surge of fast-moving blood presses against the inner lining of the blood vessels, called the endothelial lining. That pressure and shear stress triggers the release of a molecule called nitric oxide. Nitric oxide is one of the most powerful vasodilators your body produces. It signals the smooth muscle in your blood vessel walls to relax, which widens the vessels and reduces resistance to blood flow. Less resistance means your heart doesn't have to work as hard to push blood through your system, and your blood pressure comes down. Do this consistently, 2 to 3 times a week, and you're not just getting a temporary effect. Over weeks and months, you're actually remodeling the structure of your arteries, making them more flexible and responsive, and you're retraining the part of your nervous system that regulates blood vessel tone. That's a long-term physiological adaptation, not just a short-term trick. How to actually do the wall sit. Let's get practical, because the protocol matters just as much as understanding why it works. The routine used in the research is 4 sets, each held for 2 minutes, with 2 minutes of rest in between sets. You do this 3 times a week. Add it up, and that's just 24 minutes of total exercise per week to get results comparable to a blood pressure medication. Why does the wall sit outperform other isometric options? Because it targets the largest muscle groups in your entire body, your quadriceps and your glutes. The research suggests the bigger the muscle mass under contraction, the bigger the blood pressure response you get. That's also why smaller isometric exercises like hand grip training still work, but not quite as powerfully as the wall sit. Now, knee angle is the single most important variable for getting this right, And it's also the number one reason people quit. If you go too deep too fast, this exercise is brutal, and people give up on it within a week. Start conservative. Begin at around a 135-degree knee angle. That means your knees are almost fully extended, just a slight bend, nowhere close to a full squat position. If you can comfortably hold that for a full 2 minutes, then on your next set, drop the angle down by about 10 degrees. Keep progressing that way, session by session, week by week. The long-term goal is to eventually work your way down to a 90-degree angle, which is a true right angle at the knee. That's advanced. Most people take weeks or months to build up to it, and that's completely fine. Here's a simple way to know if your intensity is right. You should be able to hold a normal conversation while doing it, without your voice shaking, without your whole body trembling. If you can talk normally and steadily, you're in the right zone. If you're straining, gasping, or shaking uncontrollably, back off the angle. This isn't about maximum suffering. It's about consistent, sustainable effort. Breathing matters too. Breathe slowly and steadily through your nose the entire time. Don't hold your breath, because breath holding during isometric contraction can spike blood pressure in a way that isn't productive. If your knees are in rough shape, arthritic, or you've had knee surgery, the wall sit might not be the right entry point for you. In that case, isometric hand grip training is a strong alternative that still delivers a meaningful blood pressure benefit without stressing the knee joint. I'll link a video walking through that protocol, so you have an option either way. One more practical tip: get yourself a reliable home blood pressure cuff. Track your numbers before you start this routine, then check again after a few weeks of consistency. Monitoring throughout the day, not just around workouts, gives you the clearest picture of whether it's actually working for your body specifically. So to bring it all together, out of every exercise category tested across 270 studies and nearly 16,000 people, the wall sit came out on top for lowering systolic blood pressure, beating cardio, HIIT, and resistance training, all while requiring less than half an hour of total effort per week. And it's still barely on the radar of mainstream medical advice. If you found this useful, hit like and subscribe so more videos like this reach you, because there's a lot more research out there that isn't making it into everyday health advice fast enough. But I want to be clear about something before you go. The wall sit is a powerful tool, but it's one piece of a much bigger picture. If you actually want to understand what's driving high blood pressure at the root level and how daily lifestyle factors are quietly working against you, that's a deeper conversation. I've got a video that breaks that down in detail, linked right here and in the description. Go check that out next. I'll see you there.